Question 1. Following a 3-hour total knee arthroplasty, the surgical team places the soiled instruments, covered in blood and bone debris, into a sealed transport cart. To maintain proper physical workflow and prevent cross-contamination, to which specific area of the Sterile Processing Department, SPD, must this cart be delivered? A. The preparation and packaging area maintained at positive air pressure. B. The decontamination area maintained at negative air pressure. C. The sterile storage area kept below 75 degrees Fahrenheit, Fahrenheit. D. The high-temperature steam sterilization holding area. Correct answer B. Knowledge point explanation. Core rationale: all soiled items must flow directly into the decontamination area. This is the first stop in the strict one-way linear workflow designed to isolate biohazards and prevent clean or sterile areas from becoming contaminated. Trap analysis: option A is wrong because bringing soiled items into the positive pressure packaging area would instantly contaminate the clean environment where sets are assembled. Option C is wrong because sterile storage is the final destination for processed goods. Introducing bloody tools here violates all infection control rules. Option D is wrong because items must be thoroughly cleaned before they can even be considered for the sterilization holding area. Concept extension: maintaining negative air pressure in this receiving area ensures that airborne contaminants remain inside the room and do not drift into adjacent clean corridors. Question 2. A newly hired technician receives a 20-pound tray of soiled orthopedic instruments. Before exposing these tools to high-temperature steam sterilization at 270 degrees Fahrenheit, what is the absolute first critical step that must be performed to ensure the entire process is successful? A. Sorting the instruments based on their specific packaging requirements. B. Immersing the tray in a high-level liquid chemical germicide for 45 minutes. C. Thorough cleaning to remove all visible organic soil and bioburden. D. Inspecting the tools using a lighted magnifying glass to check for alignment. Correct answer C. Knowledge point explanation. Core rationale: cleaning is the cornerstone of sterile processing. If an item is not physically clean, the sterilization agent cannot penetrate the residual soil, meaning the microbes underneath will survive and the instrument cannot be sterilized. Trap analysis: option A is wrong because sorting for packaging occurs in the clean assembly area after decontamination, not before cleaning. Option B is wrong because high-level disinfection is for semi-critical items, like flexible endoscopes, not a prerequisite step for steam sterilizing surgical tools. It also cannot replace physical cleaning. Option D is wrong because detailed inspection happens in the assembly phase, which is only safe and effective after the bioburden has been completely washed away. Concept extension: the phrase "if it isn't clean, it can't be sterile" is a fundamental principle governed by agencies like the Centers for Disease Control and Prevention, CDC. Question 3. To legally and safely minimize occupational exposure to bloodborne pathogens during the manual washing of soiled surgical devices, what specific type of special attire must a sterile processing, SP, technician don? A. Standard clean hospital scrubs combined with a basic surgical face mask. B. Professional business attire covered by a lightweight cotton lab coat. C. Personal protective equipment, PPE, including a fluid-resistant gown and heavy-duty gloves. D. A positive pressure containment suit designed for nuclear radiation environments. Correct answer C. Knowledge point explanation. Core rationale: the Occupational Safety and Health Administration, OSHA, mandates the use of proper personal protective equipment, PPE, to protect workers from biohazards. In the decontamination area, this must include fluid-resistant barriers to prevent contaminated splashes from reaching the skin or mucous membranes. Trap analysis: option A is wrong because basic scrubs and masks absorb fluids and do not provide an adequate physical barrier against high-volume liquid splashes encountered during washing. Option B is wrong because cotton lab coats are not fluid-resistant and business attire violates basic departmental dress codes. Option D is wrong because a nuclear containment suit is an extreme overspecification not required or practical for standard medical biological hazards. Concept extension. According to OSHA's bloodborne pathogens standard, employers are legally obligated to provide all necessary PPE to their employees at no cost. Question 4. A busy medical center has 15 complex surgeries scheduled for the upcoming Tuesday morning. To optimize workflow and ensure the operating room, or, experiences no delays, when should the sterile processing, SP, technicians primarily pull and collect the required instrument sets for these procedures? A. Exactly 2 hours before the first scheduled incision time on Tuesday. B. The day or evening before the procedures are scheduled to take place. C. A minimum of 72 hours in advance to allow for extended quarantine. D. Immediately after the surgeon arrives in the surgical suite on Tuesday morning. Correct answer B. Knowledge point explanation. Core rationale. To maintain a proactive and efficient workflow, case carts for scheduled procedures are typically built the day or evening before the surgery. This allows time to identify any missing items or sterile breaches and correct them without delaying the patient's care. Trap analysis. Option A is wrong because 2 hours is an insufficient buffer. If a critical set is found to be defective, there is not enough time to reprocess it, leading to a delayed surgery. Option C is wrong because pulling items 72 hours in advance clutters the staging area, creates logistical bottlenecks, and increases the chance of sets being tampered with over multiple days. Option D is wrong because waiting for the surgeon to arrive means the room setup cannot begin, effectively paralyzing the OR schedule. Concept extension. The document used to accurately guide the pulling of these items is called a preference card, which outlines the specific needs of individual surgeons. Question 5. When a technician utilizes critical thinking and analytical skills to troubleshoot a malfunctioning mechanical washer or resolve a tray assembly error, they are actively demonstrating a core component of which professional category? A. Standard facility maintenance responsibilities. B. Employability skills required for workplace success. C. Federal hazardous waste disposal regulations. D. Clinical nursing diagnostic competencies. Correct answer B. Knowledge point explanation. Core rationale, analytical problem solving, along with punctuality, communication, and teamwork, forms the foundation of employability skills. These soft skills are essential for an SP technician to function independently and solve complex issues that arise in a fast-paced environment. Trap analysis. Option A is wrong because while a technician might troubleshoot a minor issue, repairing major facility equipment falls under the dedicated maintenance or clinical engineering department, not the SP technician's core duties. Option C is wrong because problem-solving a tray error has nothing to do with the Environmental Protection Agency, EPA, regulations governing hazardous waste disposal. Option D is wrong because technicians do not diagnose patients. Their focus is on the sterilization of devices, not clinical nursing care. Concept extension. Strong employability skills are crucial for career advancement within the department, often leading to roles such as a lead technician or shift supervisor. Question 6. 3 days after undergoing a successful 4-hour cardiac bypass surgery, a patient develops a severe surgical site infection. In the context of the Sterile Processing Department's SPD role, this type of complication is officially classified as what, and what is its primary implication for technicians? A. A community-acquired infection, meaning the technician is not responsible because the patient brought the bacteria from outside the facility. B. A healthcare-associated infection, HAI, which underscores the technician's critical responsibility to strictly adhere to all sterilization parameters, such as holding steam at 270 degrees Fahrenheit, for 4 minutes, to prevent transmission. C. An airborne cross-contamination event, indicating the operating room's negative pressure system failed during the procedure. D. A genetic immune response, meaning the infection is unavoidable regardless of the cleaning protocols used on the 15-pound instrument tray. Correct answer B. Knowledge point explanation. Core rationale, healthcare-associated infections, HAIs, are infections that patients acquire while receiving treatment in a medical facility, often emerging days after a procedure. The primary mission of the SPD is to prevent HAIs by providing strictly sterilized and safe medical devices. Trap analysis. Option A is wrong because an infection developing 3 days post-surgery is typically classified as healthcare acquired, not community acquired. It would only be community acquired if the patient had the infection before admission. Option C is wrong because operating rooms require positive air pressure, not negative pressure, to keep contaminants out. Option D is wrong because while patient immunity plays a role, surgical site HAIs are primarily caused by introduced pathogens, making strict SPD cleaning protocols absolutely essential to prevent them. Concept extension. The Spalding classification system specifically targets the reduction of HAIs by dictating that critical items, which enter sterile tissue or the vascular system, must be completely sterilized. Question 7. When a facility hires a new sterile processing (SP) technician, Human Resources utilizes a specific administrative tool to clearly define the expected tasks, physical requirements such as lifting up to 50 pounds, and daily responsibilities of that exact position. What is the formal name of this document? A. A task summary review. B. A job duty list. C. A job description. D. An occupational specification act. Correct answer C. Knowledge point explanation. Core rationale. A job description is the formal human resources document that outlines the specific duties, physical demands, reporting structure, and qualifications required for a particular role within the healthcare facility. Trap analysis. Option A is wrong because a task summary review is a fabricated distractor and not standard HR terminology. It might describe a performance evaluation, but not the foundational hiring document. Option B is wrong because while a job description contains a list of duties, job duty list is not the official comprehensive term used by facility administration. Option D is wrong because there is no such federal act. Occupational standards are set by agencies like OSHA, Occupational Safety and Health Administration, but individual roles are defined locally by job descriptions. Concept extension. Because facilities vary widely in size and technical capability, a standardized universal job description does not exist. Each facility creates its own tailored document. Question 8. A facility is remodeling its sterile processing area to comply with strict one-way workflow regulations. A technician is pushing a closed cart containing contaminated orthopedic drills toward the processing area. According to foundational infection control principles, the physical progression of these items must strictly move in which direction? A. From clean areas, through unrestricted administrative zones, and ending in soiled areas. B. From the negative pressure soil decontamination area directly to the positive pressure clean assembly area, and finally to sterile storage. C. From semi-restricted sterile storage, back into the unrestricted clean preparation room to ensure a distance of 18 inches from the ceiling is maintained. D. From the positive pressure decontamination room to the negative pressure sterile storage vault. Correct answer B. Knowledge point explanation. Core rationale. The core principle of SPD workflow is to prevent cross-contamination by strictly moving items in a linear, one-way progression, from soiled, decontamination, to clean, assembly, to sterile, storage/distribution. Trap analysis. Option A is wrong because moving from clean to soiled reverses the safe workflow and guarantees the contamination of sterilized items. Option C is wrong because reversing flow from sterile back to clean violates one-way logic. The 18-inch ceiling clearance rule is correct for fire safety storage but irrelevant to workflow direction. Option D is wrong because it incorrectly reverses the required environmental air pressures. Decontamination must be negative pressure to contain aerosols, while clean areas must be positive pressure to repel dust. Concept extension. Physical barriers, such as permanent walls and pass-through windows, are architecturally integrated into the department's design to enforce this mandatory one-way workflow. Question 9. The Sterile Processing Department, SPD, acts as the central hub for the entire hospital, dispensing processed items to various units such as the emergency department and labor and delivery. However, due to the sheer volume and complexity of the requested 25-pound instrument sets, which department is universally considered the SPD's largest and most critical customer? A. The Supply Chain Management Department. B. The Cardiac Catheterization Laboratory. C. The Operating Room, or D. The Intensive Care Unit, ICU. Correct answer C. Knowledge point explanation. Core rationale. While the SPD supports the entire facility, the operating room, or, is its primary customer because surgeries require the highest volume of diverse, complex, and strictly sterilized surgical instrumentation to function safely. Trap analysis. Option A is wrong because supply chain management deals with the procurement and distribution of disposable goods and general hospital inventory, not the end use of complex sterilized surgical sets. Option B is wrong because while the cardiac cath lab utilizes sterile supplies, its procedural volume and instrument complexity are a fraction compared to the main or. Option D is wrong because the ICU mostly requires single-use sterile consumables or minor procedure trays, not the continuous flow of heavy major surgical sets. Concept extension. The critical relationship between the SPD and the OR is often managed through preference cards and case cart systems, ensuring perfect communication for scheduled procedures. Question 10. An experienced technician is permanently assigned to the decontamination area. They are actively sorting a bloody, 15-pound mixed tray containing stainless steel retractors and a delicate flexible endoscope. To process this tray safely without damaging the items or endangering themselves, the technician must synthesize multiple specialized skills. Which of the following best describes the comprehensive knowledge required in this specific scenario? A. The technician relies exclusively on their knowledge of high-temperature steam sterilization parameters, waiting for the 270 degrees Fahrenheit cycle to clean the items. B. The technician must solely focus on instrument identification, as visual recognition is the only requirement for placing items into a mechanical washer. C. The technician must simultaneously apply knowledge of microbiology to handle biohazards, precise cleaning processes for different materials, and accurate instrument identification to separate the delicate endoscope from heavy retractors. D. The technician uses their understanding of inventory control to immediately order a replacement endoscope, assuming the bloody one cannot be reused. Correct answer C. Knowledge point explanation. Core rationale. Working safely in the decontamination area is highly complex. It requires a deep, combined understanding of microbiology, to respect pathogens, cleaning chemistry/processes, to remove bioburden, and instrument identification, to prevent heavy tools from crushing delicate ones. Trap analysis. Option A is wrong because steam sterilization does not clean items. Exposing a soiled endoscope to 270 degrees Fahrenheit would bake the blood onto the surface and permanently destroy the delicate optics. Option B is wrong because while instrument identification is vital, it is useless without the knowledge of the specific cleaning protocols and chemicals required for those identified items. Option D is wrong because surgical instruments, including complex endoscopes, are designed to be thoroughly decontaminated and reused, not discarded after a single bloody procedure. This would be a massive failure in resource management. Concept extension. Competency checklists are frequently utilized by clinical educators to verify that technicians have mastered all these overlapping skills before they are allowed to work independently in decontamination.